Good afternoon. I apologize for the brief delay. Did not send the presentation to Brian on accident. Anyhow, here we are, and this is my weekly update. All right, I can't believe it's actually October. In some ways, it feels like time has flown this year, and in other ways, it feels interminable. It is National Hispanic Heritage Month. We talked about this a little bit last week. And you'll see weekly profiles sent out via email, profiling Hispanic leaders in the behavioral health field. On this page, you see our own Leslie Flores and one of my former colleagues, Alfredo Aguirre, who was the mental health director in San Diego for a number of years, and many other really interesting people that you should learn more about. The other thing I wanted to focus on in Hispanic Heritage Month is really the inordinate impact of COVID-19 on our Latino population. And so if you look on the left-hand side, what you'll see is the California race and ethnicity data as it pertains to COVID, and on the left-hand side of the left-hand slide, it talks about the number of cases. So 61% of the cases have impacted Latinos, but they're only 38.9% of the population. So not quite doubling, but a significant increase of individuals are getting impacted by COVID who are Latino, far beyond how they represent in our population. And same with deaths. They represent about 48.4% of the deaths versus 38.9% of the population. And then when you look in Fresno County, about 60% of the deaths are Latino. And that's the upper slide, and the lower slide shows the percentage of individuals who are Hispanic in our county versus the number of deaths. So about 55% of the people in our county are Hispanic, and about 60% of the deaths are represented. So there's definitely been an inordinate impact. That's one of the things that as we get through this pandemic, my hope is that we really look critically at the social determinants of health and all of the different aspects of why someone of a different ethnicity might be higher impacted by COVID. That's something that we really need to understand better. Does it relate to the jobs that they have? Does it relate to health insurance or overall health status? Those are things we need to look into more. But as we celebrate Hispanic Heritage Month, it really brings to mind that these are things that are critically important for us to understand. We also have National LGBTQ History Month this month and Coming Out Day. And on the right-hand side, you'll see an event called Speak Out that we are hosting on mental health and wellness. This is a Facebook Live event that will be next Friday, October 9th. Between 3 and 4:30, and that will be moderated by our own Kylene Hashimoto, who serves on our behavioral health board, representing transitional age youth, and our guest speaker, Juan Acosta. And so this should be a really interesting event, and I highly recommend you taking part in that. All right, a quick rundown of COVID, and I failed to change the dates at the top. My apologies. This is as of today, October 1st, although this slide doesn't show it. Okay, I'm going to go through these quickly because I did fail to update those, but I updated this one. All right, this is California. In California, we're now over 810,000 people who have COVID, and we've had 15,792 deaths. Of note, our positivity rate statewide is down to 2.8%. This is one of the lowest positivity rates we've had since we saw that surge at the beginning of the summer. And that's a decrease from 4.2% from a couple of weeks ago when I had my update. So that's positive. I'm going to go over a couple of other numbers that are a little more concerning. The next one talks about cases in Fresno County. And in Fresno County, we are up to 27,312 cases, which this isn't accurate either. I apparently failed to do this one too. All right, we'll skip past those. We're going to go to this one. This is our metrics. We are down to 4.9% positivity rate. But what you'll see there is a slight increase from the last week. So we were 4.8, now we're 4.9%. And you'll see when I update next week, my bad, the case rate, the cases happening, and remember these need to be, this 6.2 needs to stay under 7, are starting to trend upwards. They're still down, but there's a little bit of a trend upward. And same with hospitalizations. We got to a low of 73 individuals hospitalized, and now we're up to 80 individuals hospitalized. Might be a minor fluctuation, but would not be shocking given Labor Day. And now, because we're now in the red tier officially and out of the purple tier, remember purple being widespread, where you have more than, for Fresno County, 70 cases a day and a positive rate of over 7%. We're now in the red tier, which means we're below that. And that's between 5 and 8% positivity rate and between 40 and 70 a day. And so in the red tier, we are now allowing some indoor dining, which is 25% of capacity or 100 individuals, whichever is less, and some other openings that we're able to experience that we hadn't before. So there is some concern that will kind of, what happened at the beginning of the summer will happen again as people see this reopening as COVID's over, back to normal, I don't have to wear my mask or worry about distancing. And if that does happen, we should expect to see an increase in cases again. And so that's something we're watching very closely. My caution to all of you is COVID isn't over. We need to pay attention to this, and so stay on top of it and keep following the precautions. All right, next up is the Creek Fire. You can see here that the Creek Fire is a lot less red spots from when we first started reporting on it. And so in 3 weeks, we've seen significant containment. They're now at 44% containment. And when the left side was shown, they were at 0% containment. So where you see a solid line is somewhat where the containment is started, where there's red spots, they haven't contained it. And so largely those red hot spots, if you will, are in areas where structures are not being threatened, although there's a little bit of that happening, and so a lot of work going on in the very high Sierras. And the repopulation efforts continue. We still have teams up helping out with that and meeting people at their home sites that have been destroyed and providing some emotional support, helping to guide them to other resources that might assist them as they get through this disaster. And so those efforts will be ongoing. More and more people are being allowed up into the area. There are still some unsafe situations, so there is some restrictions. It's not the time to go driving up into Shaver to look around and see what happened. You won't be allowed. Don't waste your time. And there's a lot of concern right now about so many hillsides have been impacted by the fire. What will happen when there's a lot of rain or snow? And what will be the impact on what we call the watershed? And so the next 2 weeks are critical as our county and its various departments partner with national agencies really to mitigate the impact as much as possible while they're assisting individual homeowners with mitigating the issues on their property. And so it's a very busy time, a lot of intense effort happening up there. You should give your colleagues a pat on the back who are involved in that. This is not easy work. It is very difficult to see. It's traumatic to see what's happened up there. And so this is a hard time for our community above and beyond COVID, and it's going to be hard for a while. And so the county is committed to continuing to support individuals who've been impacted by the Creek Fire, and we should anticipate that that support will be needed for some time. There will be a community meeting tonight, a town hall, if you will, up at Sierra High for individuals who've been impacted by the fire, and a lot of useful information will be provided there. And then for the next couple of weeks, at least twice a week, we will continue with these types of meetings to ensure that people know how to access services and what's going on with things like debris removal, tree removal, that kind of thing. There remains a local assistance center out at the Clovis Veterans Memorial Hall. We have staff there that's open right now 7 days a week through Sunday. And the purpose of that assistance center is to create kind of like a one-stop shop where people can go and get a variety of needs met. All right. I showed this a few weeks ago, and I just want to remind everyone again, we are in the midst of layering of disasters, and there's a lot of disaster fatigue going on. It's a real thing. It's something that we have to respect. There will be some additional resources coming out over the next few weeks through our employee assistance program to help each of us who might be at different places in our ability to cope with what we're feeling as it relates to all the different stressors that we're dealing with between COVID and the Creek Fire, and really just the grief we have over the loss of our normal life. And so I do want to remind you again about our website around disaster fatigue. Any new resources that come up will also be posted on this website, so it's really a place you can go to get the most up-to-date information and resources. And don't be afraid to call our EAP. It is there for you. That employee assistance program through Deer Oak, it exists exactly for these type of circumstances. Where you might need a brief intervention, someone to talk through some of your stressors or frustration. We are not immune as behavioral health employees and providers. We too need supports, and so don't be afraid to call Deer Oak and that EAP. That information is available as well. The other thing I wanted to touch on again, some of you may have got my mea culpa email about the video that went out last week that had some bad words in it. We will be regularly now confronting racism in our workplace. And I really have to emphasize that this is intentional on our part. I talked about that last week at our all staff. I feel very strongly that there are some difficult conversations. I do not believe our department is where it needs to be in confronting racism in the workplace. And I don't mean by this that some of you are out there as blatant racist. I think one of the barriers that we have to addressing racism is no one considers themselves a racist. If you individually polled each of our employees, they would probably be appalled at the thought that they could be considered racist. But I continually hear about comments and experiences people are having that show me that we're not where we need to be if we're really going to confront and eliminate racism in our workplace. And that could be everything from the microaggressions that you started learning about last week to casual racist comments that you might not realize are racist, a casual use of a racial slur, or using inappropriate language, or questioning someone's ethnicity or whether they're black enough. That's real, black enough to be offended by a racial microaggression. Those are the types of things that we need to learn better how to deal with. And we're going to have to really work to support all of you in developing the tools that you need to recognize when microaggressions and racism is occurring in the workplace and how to effectively, professionally, and calmly deal with it. And I understand that you don't have all of those tools, and that's okay. It's an opportunity for us to work really hard to equip everyone with the tools that they need to learn how to address microaggressions, to identify them, and deal with them effectively in a healthy way. Not in anger, not in rudeness, but in calm, professional, this isn't okay, here's how it made me or someone else feel, and here's a better way of handling this situation. So these can be really uncomfortable situations, both for the person who oftentimes inadvertently committed the microaggression, as well as the person who has the courage to confront that microaggression and really deal with it at the time it's happening. So we're going to keep talking about this, because the more we talk about it, the more we'll normalize the conversation. And just like we're trying to normalize the conversation around mental health, we're going to normalize the conversation around racism. We're going to normalize the awareness that everyone has that we all do it. We all have biases. We all say things that we don't mean to hurt anyone, that we don't even recognize are racist. And we're going to work to root that out. And really, I believe when we do that, we will create a safer space for the people who work here and a much safer space for the people we serve. And so I hope you'll join me in doing this difficult work. I do believe that as we do this work, we will become a stronger and a better department. I really, really do. And so we are here to support you, and we're also here to work with you, because we know we all have work to do. Okay. All right, what can we do in these times? I haven't changed this slide in a while because I think it's really important that we continue to focus on this. Continue to be proud of our teams. Our teams are all working so hard, both in the long-lasting COVID response as well as with the Creek Fire, and as importantly, in meeting the needs of the people we serve through all of these things. We have to take care of ourselves and our loved ones. Self-care is so important. So my advice earlier about the Deer Oak EAP is sincere. Please take advantage of it. Find outlets for yourself and support one another. Find ways to separate home from work, particularly if you're teleworking. Many of you are working really long hours. Those of you who are helping to support, particularly the Creek Fire, please take care of yourself. Take scheduled breaks, go for a walk, do some exercise. And that's my presentation today. So I'm going to look at my phone here because our laptop isn't working. I'm going to see if I have any questions. Is it possible that the DBH wellness form that we'll fill out daily can be streamlined or shortened? That's certainly something that we can look at. We've been very sensitive to that and have tried to accommodate what's happening countywide and not deviate from that standard. I know there's been work at different times to automate the process more, and so we will continue to look at that. I know it's difficult. And this particular comment went on to say it's really redundant to enter the same information every day. I gotcha. I agree with you. And so thank you for reminding us again. You know, this is one of those times when we really, topics come up and we work on them, and sometimes we solve them, and sometimes we kind of modify them a little bit, knowing there's more work to do, and then a new problem pops up, or 10 new problems prop up, or the Creek Fire happens, and we don't always really aren't able to go back and follow through on that. So thank you for bringing that up again. That is something that we can look at. Anything we can do to make your lives easier and still comply with what we need to do, we are more than willing to look at. I don't see any other questions, so I will remind you, I know that some of you sometimes can't get questions in, and just a reminder, if not today, you can send questions via email to Tina Young, my assistant. She's always watching during the presentation and will shoot me a text with the question if it comes up and the individual one of you can't get through. And then as always, you are more than welcome to contact me via email or phone call after these presentations with any questions that you have. I will do my very best to answer them. And so with that, I hope the rest of your week goes well, just one more day. And one more thing I'll say is that over the next few weeks, these will move to Wednesdays. It's just working out better for my schedule. So if you're one of those who plans ahead and wants to watch live, it will be on Wednesday afternoon.
Got a question.
Oh, one more question? Let me see. Oh, okay, thank you. One of the questions I should have anticipated, and that is, when will reassignment opportunities? I did have a chat with our HR department, and we are pretty close to having particularly the unlicensed mental health clinician job specifications done. We're just waiting to see if we need to do any further work on that to follow all the rules that we need to follow. But we're getting ready to really commit that one way or another, we will look at all the needs across the divisions and likely offer a reassignment opportunity by the end of the year. And so I know that's been a common question here and a difficult one for us to answer when we really had our hands full with a lot of other priorities. We did make that a priority to get that process through HR, and it has been moving through, and we're pretty close. But if it doesn't get done in time, we will commit to doing a reassignment opportunity by the end of this calendar year, if that wasn't clear. And then one other question that came through is the flu shot really mandatory? There is a health officer order, and essentially the way it's being interpreted for our department is that anybody who works in an area where we serve the people we serve. So if you work at Metro or Heritage or West Fresno, where you still have clients coming in for care, whether you're providing that clinical care or you're working to support the staff that's providing that clinical care, we will expect you to get a flu shot. There is a drive-through clinic this weekend, and that information is on our website and on Public Health's website. You may go and to Rite Aid and CVS and Target and many other places and get a flu shot if you don't have time to get an appointment at the doctor. That's how myself and my daughter got our flu shots this year. I think I told you before, oftentimes you get a $5 gift card if you do that, and it doesn't cost anything because your insurance pays for it. So there's lots of different ways to get the flu shot. The importance of the flu shot this year is really exponential compared to past years. We simply do not know at this point what will happen if someone gets the flu and COVID. We also are concerned that not knowing how bad the flu will be this year, how will individuals needing hospitalization or healthcare services for flu and individuals needing hospitalization for COVID, how will that impact hospital capacity? Now, one thing that we have in our favor is so many of us are wearing our masks that some of the ways that the flu is spread are also the ways that COVID is spread. So keeping our distance, washing our hands, wearing our masks is certainly one way to prevent getting the flu along with COVID. But if you can get the vaccine, you should get the vaccine. It's just one more measure of protection because we don't know. Would COVID be more lethal if you got it when you had the flu? We don't know. I will mention that the only person I personally ever know who's died of the flu died because they had two viruses at the same time. It was a young boy, under 10 years old, perfectly healthy, no health issues, and he got two viruses at the same time, and it killed him. And so I take this pretty seriously. And so if you have the chance to get the flu vaccine and don't have any principled objections to doing so, I highly recommend that you get it, even if you're not required to get it through our department.
I believe Tina sent you one more question.
Okay. And then, okay, it was about talking about flu shots. I had one more question, it was flu shots. Yeah, so again, many places to get them. If you are having a hard time getting them or aren't sure what to do, please contact Human Resources. We are more than happy to assist you in determining how best you could get a flu shot for you and your family. Just for instance, the clinic tomorrow or on Saturday, which is first come, first served, your whole family could go to it. Now, one of the challenges that does exist is that there's not always an oversupply of flu vaccine. And so we are looking into whether or not our department could get some flu vaccine and be able to conduct a drive-through clinic, but there have been some barriers to that. So we're really pushing that there's many other ways to get the flu vaccine, the flu shot, and that you should not rely on us coming up with a clinic. But we highly recommend it. The more people that get the flu shot, you almost get like that herd immunity as well, and so that will help us too. All right, let's see if there's any more last minute questions. from anyone. Is it legal to require workers to take the flu shot? People should have the right to choose. If you'll go on the website, you can see what the order reads. It is actually legal to require you to take the flu shot. It is a public health issue. Now, there are some exemptions from that, and if you look at the website, you can see what those exemptions are. I appreciate people's desire to have personal liberty and freedom. It becomes challenging when your personal liberty and freedom puts other people at risk. I like to compare it to driving down the freeway. I love going fast. It's just one of the things I like to do. And I would like the freedom to choose to go as fast as I want, particularly when the freeway doesn't seem to have a lot of cars. However, my freedom to go as fast as I want on the freeway puts other lives at risk. And so as society, we've agreed that my freedom to go as fast as I want in my car puts others' freedoms at risk, and so I'm not allowed to do that. And I actually can get pulled over and get a ticket. And there's other things like that. There's some things like wearing your seatbelt that's required by law that doesn't necessarily protect other people, but where our government and voters and such have determined that the risks to you of getting injured when you don't have a seatbelt are so great that we've decided as a society that that's a law that we should follow. And vaccines are one of those difficult things. I know there's a lot of opposition to vaccines, and I'm not going to try and change your mind, but it is a public health, it's considered a public health emergency right now, and so that order was written and we do need to follow it. Okay. Some people have symptoms when they get the flu shot. Will they be required to quarantine if they have symptoms, or how will this be addressed? That is something that we'll work through with our Human Resource Department. If you were to take the flu shot and get symptoms related to the flu shot, it would be my expectation that we just work through what those symptoms were. Are they consistent with COVID or not? How close were they to the flu shot? And maybe even involve a physician of your choice to determine whether or not we should view that as a COVID concern or not. These are difficult times, and some of the answers I give you won't like very much. And some of it might not satisfy you when I say things like, we'll have to figure that out. But we are learning as we go, and so I would ask for grace and your patience that some of these difficult situations we're just now figuring out. Will we need to submit vaccination verification? That's something we're working through right now as well. Like, how would you validate that you had had it? And then, well, I'll just say, someone said a car is not a human right, but my human body is mine, not the property of my job. Everyone has a right to their opinion, and you have a right to choose whether or not you want to participate in an organization that has to abide by public health orders. This is an organization that has to abide by public health orders, and it may not be in alignment with your values, and that's something I can't decide. That's only something that you can decide. And I'm happy that we live in a society where you do have the right to decide that. And I support you in making that decision if this organization's values don't align with your values. All right. I don't see any other questions now, so I'll just remind you once again, if you have questions and you didn't get the chance to ask them here, or you had some further clarifying questions over something that was asked, please feel free to reach out to me after this meeting, and I am more than happy to answer them for you. Have a great week and a great weekend, and I'll see you next week.